A proposed policy from BC's health minister requiring drug use spaces in all BC hospitals, something some cities have pushed back against, is something Vancouver Coastal Health tells City News it has no information on. This comes as Minister Adrian Dix told the Globe and Mail on Thursday that hospitals would have to provide these spaces for people with substance use disorders, only to tell reporters on Friday that wouldn't be happening.
No, that's not the decision. What we're doing is looking at issues like that. Of course, they have to be reviewed. In fact, some hospitals do have such facilities. People can be interested in the politics of it, and I understand that. I'm in politics, so I understand that. But what we're interested in here is about the health care of it. And that means every patient who goes to hospital has their interests protected. And every staff person who works in a hospital has their interests protected. So we haven't made that decision, and I don't think it's likely we would.
We reached out to the minister on Monday for clarification, but he didn't provide any more information before broadcast. Nurses at BC hospitals have recently spoken out about the challenges of working around open drug use, while a report last month from the Auditor General found the government hasn't done enough to implement overdose prevention sites. Brittany Graham with the Vancouver Area Network of Drug Users says having drug use spaces at hospitals is a good step, but it can't be the only step.
The one thing that I would be concerned about is that this would be the one step moving forward, is that we need overdose prevention services in many different places. And if in a town where they have no overdose prevention services currently, and a hospital will be the only place where they can access that service, that's putting unnecessary burdens on the medical care facilities that already exist in that town.
On Sunday, BC marked 8 years since it declared a public health emergency due to toxic drugs killing people, and since then the morbid trend has kept going up, with over 14,000 people dead in BC. In response to the crisis, BC became the first jurisdiction in the country to decriminalize the possession of hard drugs, including cocaine, heroin, meth, and ecstasy, as part of a pilot project to reduce barriers that keep people from accessing life-saving services, including its prescribed safer supply programs, which provide addiction medicine and other substances. In Vancouver, Kier Junos, City News.